So let's go to the countries that have, eased out and have not gone back into lockdown. Let's use the example of one that I read just a 2-3 days ago, and that's Taiwan. And the aggressiveness of wearing a face mask was such that, in fact, some folks there were asking whether their pets too should wear a mask. Of course, that was not needed. But that's to tell you the extent to which the information about the need and the compliance of wearing a face mask had gone. So for us not to go back to a lockdown, a total lockdown, we need as a people to ensure that nobody that gets out, steps out of his house, has his face open, wears a face mask. We need to aggressively ensure that, community-based testing is going on. Look, we have examples. We don't need to go far in how to ensure that we do that. There is a mapping that needs to be, that we currently are doing. And that mapping is to say, if we come to Abuja or to FCT, must we go and test everybody in FCT, or can we now begin to narrow it to epicenters? And once we are done with mapping it out, we can put in all the resources that we have in the places where we have a lot of concentrated cases, while ensuring that we do not totally leave out the other areas that don't seem to have a case, because maybe it's because they are not testing that they are not seeing it. So summary is test as much as you can, using whatever strategies you are to maximize the resource that you have, and then wear your face mask, social distancing. And talking about the testing, people have said, well, 18 laboratories, in what way will that be adequate? And I think that, yes, we can add the number of testing sites, and there's quite a lot of work going on there in ensuring that we have additional testing sites, at least in every state. But I think the logistics of sample collection is very, very key in utilizing and maximizing the use of even the available labs, because sometimes you hear statements like, we have not even maximized the use of the current labs that we have. We have X number of labs with X capacity, but they are underutilized. Well, they are underutilized because samples are not coming. Samples are not coming because the logistics for sample transfer has not been adequately arranged. My advice has ever been, for weeks now, that every primary healthcare center in Nigeria should have the capacity to be able to collect samples, store the samples, take the samples to, even if it is taking it first to a staging area, and then from the staging area to the lab. And then the turnaround time, if we can make it a minimum of a maximum of 24 hours, 48 hours maximum, then we will be able to get results back early enough for those who are positive to know their fate. Because if you are doing a community testing, you go there, you test, you don't tell everybody, you advise them on personal hygiene, you advise them on ensuring that they maintain social distancing and wearing of masks if they have a cough. But you probably, because they have not tested positive and they have not been exposed to a case, you are not strictly isolating them. But if they get the test early, it reduces the exposure to others.